Other mood disorder is premenstrual dysphoric disorder. Occurs 7 to 10 days before menstruations and goes away within a few days of the start of the menstrual period. Intermittent explosive disorder. It is commonly referred to as flying into range for no reason. The behavioral outbursts are out of proportion to the situation. The causes of mood disorder. They may be several underlying factors depending on the type of the disorder. Various genetic, biological, environmental, and other factors have been associated with mood disorders. Risk factors include family history, previous diagnosis of a mood disorder, trauma, stress, or major life changes in the case of depression, physical illness, or use of certain medication. Depression has been linked to a major diseases such as cancer, diabetes, Parkinson's disease, and heart disease. Brain structure and function in the case of bipolar disorder. Prevention. Number 1. Maintain a stable sleep pattern. Too much or too little sleep patterns can alter the chemicals in your body and can trigger mood changes. Second, set realistic goals. Having unrealistic goals can set you up for disappointment and frustration, which can trigger a manic episode. Third, avoid caffeine, alcohol, and drugs. Cut back on coffee and soda, especially at night. Alcohol and drugs can affect how your medication work and possibly trigger the mood episodes. Get moving. Study shows that regular exercise can help improve mood. Start slowly by taking a walk around the neighborhood. Reduce stress at home and at work. Try to keep regular hour at work or at school. Keep track of your mood every day. After you know your early warning signs, check your mood daily to see whether you may be heading to a mood swing. Write down your symptoms in a journal. When you see a pattern or warning signs of a mood swing, seek treatment. Continue treatment. It is important to continue treatment as prescribed to avoid taking risks or having unpleasant consequences from a manic episode. Diagnosis methods. Mood disorder are diagnosed through both physical examinations and mental health evaluations. Your physician will perform a physical exam to rule out any underlying medical conditions that are causing an effect on your mood. If ruled out, a mental health provider may perform a series of assessments to determine your mood stability and mental health. Mood disorder treatment. Treatment will depend on the specific illness and symptoms that are present. Usually, therapy involves a combination of medication and psychotherapy. Therapy sessions may be conducted by a psychologist, psychiatrist, or other health professionals. Medication to treat depression and bipolar disorder. Antidepressants. Many different medications are available to treat depression and the depressive episode of bipolar disorder. Some of the most widely used drugs are selective serotonin reuptake inhibitors. Second, mood stabilizers. These medications help to regulate the mood swings that occurs with bipolar disorder or other disorders. They reduce abnormal brain activity, mood Stabilizers may also be prescribed along with antidepressants in some cases. Antipsychotics. Patients with bipolar disorder who experience mania or mixed episode may be treated with an atypical antipsychotic drug, such as aripiprazole. Atypical antipsychotics may also sometimes be used to treat depression if symptoms are not controlled with an antidepressant alone. Psychotherapy, talk therapy. Patients with depression and other mood disorder may benefit from various types of psychotherapy or counseling sessions. Brain stimulation therapies are thought to work by causing changes in the chemicals in the brain that are known to be associated with symptoms of depression and bipolar disorders. Light therapy. This technique has long been used to treat seasonal affective disorder. It is based on the idea of supplementing natural sunlight with bright artificial light during the fall and winter. How to help someone with mood disorder. Be aware of the signs and symptoms. Individual and families need to learn about the disorder. Support your family member to manage their illness. Continue to love them even when you want to give up. When a person is depressed or manic, they may not act like their normal selves and may need extra patience and attention. Encourage them to sleep regular hours and have daily routine. Spend quiet time together at home if they don't feel like talking or going out. Don't try to fix your loved one's problems or in your own. Encourage them to get professional help. Recommend helping resources such as therapy, online resources, or depression hotline. What you can say that helps. You are not alone in this. I'm here for you. I may not be able to understand exactly how you feel, but I care about you and want to help. Tell me what I can do now to help you. I am here for you. We will get through this together. You are important to me. Your life is important to me.